Secretary to the Government of the Federation, honorable ministers here present, Director General, directors, ladies and gentlemen. The number of confirmed COVID-19 cases in Nigeria has continued to rise, not unexpectedly, in view of prevailing circumstances in certain states of Nigeria. As at midnight yesterday, the 5th of May, 148 persons had tested positive, bringing the total to 2,950 confirmed to have COVID-19 in 34 states and the Federal Capital Territory. 481 persons have been discharged, and 98 COVID-19 related fatalities have sadly been recorded. The 148 new cases were reported in 17 states as follows: 43 in Lagos, 32 in Kano, 9 in Katsina, 10 in the Federal Capital Territory, 14 in Zamfara, 7 in Taraba, 7 in Borno, 6 in Ogun, 5 in Oyo, 3 in Bauchi, 3 in Edo, 3 in Kaduna, 2 in Adamawa, 2 in Gombe, 2 in Plateau, 1 each in Sokoto and Kebbi. Clearly, in community transmission phase, where much now depends on individual and collective behavior, and the urgency of behavior change communication becomes apparent. Knowledge so far gathered about COVID-19 needs to be converted into practice. Now more than ever, depends on all of us. We are to adhere to public health advisories, the wearing of our masks, observing social distancing, practicing hand washing or sanitizing, standard respiratory hygiene, avoiding crowded places, and also avoiding all manner of non-essential travel, as well as reporting when we feel unwell or someone close to us has symptoms of infection. If not, we expose ourselves and our loved ones to risk and inadvertently increase the period this virus will be with us and make life worse for all of us. For example, large crowds reported that certain events and the movement and repatriation of persons from one state to the other do contribute to the problem and do not indicate a good understanding of the urgency of this situation. Therefore, I again appeal for considerate and responsible social adjustment to the challenges which Nigeria faces. While we are striving to increase our testing capacity, we have noted the complaints about turnaround time to get the results of tests conducted. NCDC is doing all it can to resolve these issues. We have also continued to train and retrain our healthcare workers, as well as provide them with the necessary personal protective equipment. The reported cases of infection in Kano are a case in point, showing the urgent need for intensifying training, particularly among healthcare workers. It is clear that many doctors and nurses who are not familiar with the protocol for the infections of this caliber will benefit from the training. Community mobilizers have been deployed at the grassroots to continue to sensitize our people through the National Primary Healthcare Development Agency. I participated earlier this week in a teleconference of the Northern Traditional Leaders Committee organized by NPHCDA, in which the need for urgent engagement of all traditional, religious, and community gatekeepers was emphasized and agreed on. We are encouraging and supporting states to increase the number of isolation centers nationwide and also the quality of the isolation centers. And we're extremely grateful to corporate organizations and philanthropists who have donated isolation facilities, diagnostic equipment, commodities, and sundry supplies relevant to our response effort to COVID-19 threat. One example is the This Day Dome, which has been repurposed by donors to be a 300-bed isolation center with a 10-bed ICU unit, which is to be commissioned next week and significantly ease the availability of bed space. With regard to Kano, much progress has been made in collaboration efforts with the State Ministry of Health and the EOC to restore routine medical services to hospitals, to improve the confidence of the doctors and health workers, and to further drive the ongoing investigations in the state. Organized ambulance service is already in operation, bringing relief to citizens who need to access medical service, especially at odd hours and in view of restrictions of movement, and also in emergency situations. The Federal Ministry of Health is sending supporting teams to Sokoto, Katsina for training, capacity building in case management and infection prevention and control in the hospital setting. Other states shall follow at short interval to assist the state ministries of health in their response to this threat. This training is particularly important because we cannot afford to lose the services of healthcare workers at the rate it is going. We have also received donation of an incinerator, which will be installed at the Aminu Kano University Teaching Hospital for effective waste disposal, particularly of these infectious materials. I wish to appreciate the effort of our traditional rulers again, our religious leaders and community leaders in sensitizing our people to the importance of compliance with COVID-19 infection prevention measures. I remind everyone that this is even more critical as the restrictions to movement are being relaxed. The value of the tentative easing of the lockdown, which was announced by His Excellency the President, depends on population adherence. I urge all citizens to practice and use various media options available to them to propagate and support the guidelines issued by the PTF. We again recognize our frontline and backroom healthcare workers, the caregivers, hygienists, security, drivers, porters, and others for their tireless efforts to continue to adhere to self-protection regulations. I also thank all those citizens who adhere to infection prevention and control and non-pharmaceutical intervention advisories, and urge you all to propagate it to your neighbors. Thank you for listening. I shall now invite the DG of NCDC.